Hospitals are a critical part of a community's livelihood, but do you know what a transitional hospital is, and does your insurance cover it? In today's Focus on Your Health segment, Nancy McCormick, a clinical liaison with Kindred Health, is here to tell us that and so much more. Good morning.
Good morning.
So it's interesting, we've kind of been chatting this morning about what exactly a transitional hospital is, because I don't think a lot of people, they've been around for a while, but I don't think people really understand the need that you guys are fulfilling. It's really a big need. Explain what a transitional hospital is.
Well, it's a specialty hospital for those patients that are going to need a longer period of time to recover and remain in a hospital setting.
So you think of somebody getting sick or having surgery, something coming up, they go to the normal traditional hospital,
right.
And then what happens after that? They either go home because they're all better, or they're not well enough to go home, but they can't stay there, right?
Well, exactly. Patients that are medically complex, that are going to need weeks versus days to recover. Kindred and long-term acute care hospitals or specialty hospitals are licensed for that longer length of stay.
So what are some examples of people who may need this? And I'd imagine, how do they find out that you're here and that you're available?
Well, usually they'll find out in the hospital setting when a physician feels that our services are needed.
Okay.
But that's why we're trying to get the word out about these transitional hospitals. But a patient may have respiratory complex problems, ventilator weaning or pneumonia. They may have large wounds that need weeks versus days to heal. Dialysis patients that are too complex to be able to go to an outpatient facility that may need to stay in a hospital setting.
I would imagine the demand for this is really, really plentiful. I mean, there is a need for this in our community,
There is,
correct?
Absolutely.
Now, I would imagine some people that go, oh, well, I can't afford that, or I can't, you know, it seems like it'd be a lot more. Number one, the traditional hospitals are going to be expensive if you try to stay there.
And they are.
Yeah, and then number two, does insurance cover this? Is this something that people can look into?
Absolutely. We take all major insurances as well as veterans and workman's comp.
Well, and I'd imagine insurance companies would want you in the care of professionals, you know, as well, instead of at home trying to figure it out yourself.
Absolutely.
I would
absolutely.
So if someone is interested in finding out, you know, more about what it is, you know, the services that you provide, if this would be a good fit for their family, what would you suggest they do?
Well, they can dial 1-866-KINDRED. There's an RN on the line 24 hours a day that they can call and ask about the different levels of care, as well as what their insurance
Oh, good. So you can go ahead and give that information. Right. When it's so good that someone's on the other line to actually, you know, speak with, especially when you're dealing with medical decisions and medical care, people want to be, you know, feel like they're heard.
Absolutely. So they can go there, or they can go to kindred.com and get lots of information about all of this.
And what's interesting too, as we kind of wrap up with traditional hospitals, it seems like you guys are equipped, because there are so many different services you provide there. You can really handle anything.
Just about.
This is going to fit, you know, most families.
Absolutely. Just about. So we are an acute care level hospital. We have an ICU, but we also offer physical therapy, occupational therapy, speech therapy, as well as wound care and other services.
All right. Well, thank you so much for being on the show this morning.
Thank you so much for having me.
You know, I got a little lesson in this morning.
Good.
So yeah, we look forward to having your team back. So thank you so much. And again, there is the number to call to find out more, and their website as well.